Hello everyone, welcome to my another video. Today we discuss about important MCQ on vital signs. This is part 1. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 1. Before taking temperature, thermometer need to clean from option A, bulb to stem, B, stem to bulb, C, middle to stem, D, middle to bulb. Right answer is option A, bulb to stem. Before taking temperature, thermometer has to be cleaned from bulb to stem, and after taking temperature, cleaning has to be done from stem to bulb, that is more clean to less green area. Next question. First heart sound S1 indicate closure of dash valves. Option A, mitral and tricuspid, B, aortic and pulmonic, C, mitral and pulmonic, D, tricuspid and aortic. Right answer is option A, mitral and tricuspid. The first heart sound S1 represents closure of the atrioventricular valves, that is mitral and tricuspid valves, as the ventricular pressure exceeds atrial pressure at the beginning of systole. Next question. What is the other name for collapsing pulse? Option A, thread pulse, B, water hammer pulse, C, bounding pulse, D, pulse deficit. Right answer is option B, water hammer pulse. Water hammer pulse is used to describe a pulse that is characterized by very rapid upstroke of the peripheral pulse followed by rapid collapse. It is seen in aortic regurgitation. Next question. Irregular respiration characterized by apnea and hyperventilation is known as option A, sinus-stroke respiration, B, hyperventilation, C, Kussmaul respiration, D, sighing. Right answer is option A, sinus-stroke respiration. Sinus-stroke respiration is an abnormal pattern of breathing characterized by progressively deeper and sometimes faster breathing followed by a gradual decrease that results in a temporary stop in breathing. Next question. The type of fever in which the temperature fluctuates more than 2 degrees centigrade, all above normal during a 24-hour period is option A, intermittent fever, B, remittent fever, C, recurrent fever, D. Relapsing fever. Right answer is option B. Remittent fever. Intermittent fever is a type of fever in which there is an interval where temperature is elevated for several hours, followed by an interval where temperature drops back to normal. Recurrent fever can be a symptom of various illness such as periodic fevers, pharyngitis, and adenopathy. Relapsing fever is a vector-borne disease caused by bacteria in the genus Borrelia, which are transmitted through the bites of lice or soft-bodied ticks. Next question. What is the term used for normal respiratory rhythm and depth in a client? Option A. Eupnea, B. Apnea, C. Bradypnea, D. Tachypnea. Right answer is option A. Eupnea. Eupnea is normal, good, unlabored ventilation, sometimes known as quiet breathing or resting respiratory rate. Next question. The nurse is examining an 8-year-old boy with tachycardia and tachypnea. Which of the following non-invasive tests can determine the extent of hypoxia? Option A. Pulmonary function test, B. Pulse oximetry, C. Peak expiratory flow, D. Chest X-ray. Right answer is option B. Pulse oximetry. Arterial oxygen can be monitored non-invasively and continuously using pulse oximeter probe on finger or toe. Next question. Increased depth of breathing with normal respiratory rate is called option A. Hyperpnea, B. Bradypnea, C. Orthopnea, D. Kussmaul's breathing. Right answer is option A. Hyperpnea. Increased depth of breathing with normal respiratory rate is known as hyperpnea. Bradypnea means abnormally slow breathing. Orthopnea means discomfort in breathing while lying down flat. Kussmaul's breathing means deep and labored breathing associated with severe metabolic acidosis. Next question. If a narrow cuff is used for measuring BP, then what will the outcome? Option A. Actual reading will be obtained. B. Falsely high reading will be obtained. C. Falsely low reading will be obtained. D. BP cannot measure. Right answer is option B. Falsely high reading will be obtained. Use of narrow cuff leads to falsely high reading, and use of large cuff will cause falsely low reading. The width of the BP cuff should be 40% of the circumference and length of the cuff should be 80% of the circumference. Next question. Location of auscultation for apical pulse is option A, fifth intercostal space at the right mid-axillary line, B, fifth intercostal space at the left mid-clavicular line, C, fifth intercostal space at the right mid-clavicular line, D, fifth intercostal space at the left mid-axillary line. Right answer is option B, fifth intercostal space at the left mid-clavicular line. Location of auscultation for apical pulse is fifth intercostal space at the left mid-clavicular line, where the apex of the heart is located. So this is the today's video. Thank you so much for watching my video.